Now, the Nigeria Center for Disease Control, NCDC, through the National Emergency Operations Center, has continued to lead the national public health response in Nigeria with oversight of the Presidential Task Force on COVID-19. The NCDC is also working closely with all states of the Federation to support their response activities to the pandemic. The center has published a new public health advisory on COVID-19 with updates on the third phase of ease lockdown, travel advisory, advice for health workers, businesses, and other guidelines. Joining us from our Abuja studios is Madam Chioma Danwafo. She's a senior epidemiologist with the Nigeria Center for Disease Control. Thank you so much for joining us on the program.
Good evening, Nigerians. Thank you, Melissa, for having me.
All right. We understand that the public health advisory on COVID-19 is a revised one. This is the 7th. What has changed since the last one?
Yes. So the public health advisory was changed following the third phase of the ease of lockdown. If you recall, the PTF has been we're going through phases of the easing of the lockdown since May, and with the recent one, we have highlighted key measures to address the current issues based on the realities and the context of our country, Nigeria. This is basically to address and balance issues around economic, socio-political, and also the health concerns of COVID-19. So the first on the list is the current nationwide curfew. If you recall, for the second phase, we had the curfew between 10 a.m. and 4 p.m., but now it's between 12 a.m. and 4 a.m. And also for mass gathering, we've increased from the initial 20 persons that was allowed for mass gathering to 40, but then ensuring that the non-pharmaceutical interventions are strictly adhered to while people gather for burials or for other activities. Then opening of airspace. Before now, the international airspace was closed, but now FCT, the international airport, Lagos and FCT have been opened up, and we now have a portal called the NIPTS, that's the Nigerian International Portal, Travelers Portal. So this is to ensure that all travelers that are coming in or leaving the country gets tested. So you link up to this portal, which is the website, which is nipts.ncdc.gov.ng, and put in your details. It will direct you to an access where you can pay, and then also schedule for when your test will be conducted. That will be on the 7th day on arrival in country, or 96 hours before you depart Nigeria. That's for outbound passengers. So this is in collaboration with the private sector. Most of the testing laboratories are the private laboratories. And also we have, for the mandatory use of face masks, is still in place. Nothing has changed. For face masks, we're also encouraging service providers to ensure that the no mask, no policy is strictly adhered to, and that people comply before they come into public places. Also, elections, as Edo and Ondo plan to go to the polls, we are also emphasizing that voters must wear their masks, and also at the physical distancing. So the no masks, the no voting is one of the key highlights of the current guideline that advisory we have released.
But another question as well is, how much are people listening to this, the population that we have? You've put this out there, but are you breaking this down so that people are aware, people can wear their face masks, and those coming in, how much of surveillance will be taking place at the port of entries since domestic and international flights are now on?
Yeah. Thank you. So it's quite unfortunate that the risk perception for COVID is on the decline. So we're noticing that people are throwing caution to the wind. They're no longer wearing the face masks. But then we continue to pass these messages through the traditional and social media platform and in collaboration with the state, because for this outbreak, it's the states that are leading the response to ensure that people adhere to the non-pharmaceutical intervention, that is wearing of the face masks, mandatory wearing of face masks in public places, personal hygiene, ensuring they wash their hands, and also cough etiquette, coughing into their elbow or using a handkerchief, and also physical distancing. So we cannot overemphasize on this non-pharmaceutical intervention because it has worked. For countries that have been able to contain the virus, this has been shown by research and evidence and science that it works. So as a country, we all need to take responsibility and ensure that we adhere strictly to the non-pharmaceutical interventions. And for the for the testing and for passengers that are coming in, we have also put measures in place. It's a multi-sectorial response led by, through the PTF. There have been some guidance that have been put in place. We are working with FAN, NCCA to ensure that all passengers that are coming in adhere strictly to all the measures that have been put in place.
All right.
On the website, it is clearly spelled out that the test must be conducted on the 7th day. And once you come into the country, first and foremost, you must have carried out a test from the country that you're coming from, and you have a negative test that you upload on the website. And once you come into the country, you would self-quarantine for a period of 7 days. And after the 7 days, you you conduct the test, and if it's negative, then you are free to unite with, conduct your daily activities or unite with with the public and carry out your normal activities.
We'd like to thank you. We appreciate your coming on the program. Chioma Danwafo, Senior Epidemiologist with the NCDC. Thank you so much, and all the best in your activities.
Thank you for having me.